Hi, so in this video we would like to talk about ectopic pregnancies, why they happen, and what are some of the treatments that are available to treat this condition. So ectopic pregnancies are also known as extra-uterine pregnancies, and they are pregnancies where the fertilized egg that is traveling down the fallopian tube did not manage to exit the fallopian tube into the uterine cavity. It ended up implanting, for example, in the fallopian tubes or in the cervix, or in the uterine horns, or in rare cases outside the uterine cavity, in the pelvic cavity. So, as the name suggests, right, this type of pregnancy did not implant in the intended location. The intended location is the uterine cavity, specifically the endometrium. But for this type of pregnancy, it did not implant there. It has implanted in several other locations that is not really optimal for its growth. And the most common type of ectopic pregnancies happen in the fallopian tube. So this type of pregnancies that has implanted in the fallopian tube, we have a specific name for them. These are called tubal pregnancies, and up to 90% of ectopic pregnancies are tubal pregnancies. The rest of them may happen, but they are slightly not so common. So why do they happen? This type of condition usually arises from a number of factors that the patient has. There are certain underlying organic diseases of the uterus that the patient has that she has not dealt with, and she has carried on with a pregnancy. The most common cause for an ectopic pregnancy is a congenital uterine malformation. For example, septate uterus or naive uterus and other forms of uterine malformation causing ectopic pregnancies. Furthermore, if she has pelvic adhesions or adhesions in the fallopian tube. So this is also another common reason, because adhesions will block the traveling of the fertilized egg. So it will make it stuck and unable to exit the fallopian tube, which is why fallopian tube pregnancies are so common. So there are several other factors as well, but the most common types are adhesions and congenital uterine malformations. So to prevent this type of pregnancy from happening, it is very important that you get yourself checked before you get a pregnancy, go for a pregnancy. It is very important to go for a prenatal checkup to avoid any type of complication. In many cases, miscarriages, recurrent miscarriages, ectopic pregnancy, chemical pregnancies can be prevented if patients go for a comprehensive prenatal checkup. So for ectopic pregnancies, how do doctors treat? A lot of doctors do not actually treat this condition properly. A lot of them also offer removal of the fallopian tube, termination of the pregnancy, without offering them a solid and helpful treatment plan that helps them secure the pregnancy to keep it. Here at Antai Hospital, we have two options. First option is that, of course, we want you to keep your pregnancy. If you and your partner decide to keep the pregnancy, we will proceed with a transplant surgery to place the embryo back into the endometrium. So this is a very more complex and advanced surgery that will need to use 3D laparoscopy to surgically remove the embryo from the fallopian tube. For example, if it's a tubal pregnancy, you will remove it from the fallopian tube, place it into an endometrium. This is very similar to how IVF works, so a lot of doctors will call this surgery a natural IVF. Secondly, if you do not wish to keep the pregnancy, or this ectopic pregnancy is threatening your life. Ectopic pregnancies are very dangerous because they can cause rupture of the fallopian tube, and this will cause massive internal bleeding. So if it is this case, you have no choice but to terminate the pregnancy. And how we do this is that we use 3D laparoscopy to also surgically remove the growing embryo, and then we will seal the incision surgically and also prevent adhesions to form. So we will also give some medication if the condition is not so serious and requires surgery. Certain medications can also terminate the pregnancy. Furthermore, before your next pregnancy, you must deal with the primary cause of your ectopic pregnancy. If you do not deal with the primary cause, in your next pregnancy, you're going to face the same situation again. So what are the primary causes? As we mentioned, congenital uterine malformation and adhesions. All of these can be diagnosed and treated pretty straightforward and effectively. We will also use 3D laparoscopy to treat. For example, you have a uterine malformation problem, you have a blocked fallopian tube problem, you have uterine adhesions, pelvic adhesions, all of this can be diagnosed and treated effectively so that you can secure your next pregnancy. So I stress again, before you go for a pregnancy, go for a comprehensive prenatal checkup. It is very important for to have a successful and healthy pregnancy.